Diyan, son plaisir pour moi, particulièrement pour moi qu'à introduire nous, moun qui pour aller parler pour nous, hein. C'est Véronique Delva. Et moi, juste trouvé que son monde que me connaît très bien, depuis plus de presque 29 ans que nous connaît, parce que c'est moi qui maman li, et c'est un grand plaisir, vraiment un grand plaisir que les prêt pour les partager connaissances ensemble avec nous.
Okay, well, hi everybody. My name is Nikki, and I'm very happy to be presenting this topic about cancer genetics and why it matters and why it's really relevant to all of us. I want this to be an open dialogue so we can kind of jump in. I do have some questions or more interactive parts throughout the presentation, but feel free to stop me at any point if you have any questions or need any clarification. I'm currently a cancer genetic counselor at Mount Sinai Hospital in New York. I have been a cancer genetic counselor for the past 3 years, and so I'm happy to impart the stuff that I've learned and the stuff that I think is, valuable. Okay. All right. I really want this to be like you don't see the side, but it's okay. All right, so these are some of the objectives that I have for the day. So I'm going to start off with kind of zooming out a little bit, talking about what is cancer in the first place, discussing some like screening and prevention options related to cancer, and what does genetics have to do with cancer in the first place. What is cancer genetic testing, which throughout the presentation I'll also refer to as CGT. And then who should receive cancer genetic testing? What's the point of doing it in the first place? And then some examples, and then Q&A is open at the end. Okay, whatever. All right, so what is cancer? So our body is made up of trillions of cells, and they constantly die, divide, and grow. And sometimes mutations can develop in those cells that can ultimately lead to abnormal growth in the body. And essentially, cancer is when these cells are mutated and they're not working like how they should. And then they start to spread to different areas of the body. Different cancers react and move differently depending on what type of cancer type it is. Some cancers are extremely slow growing, whereas some, are more rapidly growing. Some tend to have a better prognosis compared to others, depending on what stage, obviously. But cancer looks different for everybody. There can be two women who both have diagnoses of breast cancer and have very different experiences. It just depends. But overall, cancer and what it is just your cells are growing at a crazy rate, and they're growing uncontrollably ultimately.
Nikki, if I may,
Yeah.
you're going a bit fast.
Okay, sorry.
No. I was gonna say if you would allow me to do a translation,
Oh, yeah.
yeah, as you go.
And I'm gonna try to also fix this, but go
Not
ahead.
everything, but just, if you can chop it off for me, and then I'll be able to.
Okay.
Mhm.
Oh, okay, but sorry, before you even do that explanation, like, could you just clarify? Are you basically saying that cancer is just cells reproducing where they shouldn't be?
Yeah, essentially just your
Yeah,
cells just growing uncontrollably more than
where they shouldn't be.
yeah.
Right.
So typically your cells are alive, they're growing and dividing in
Mhm.
all areas of your body. We have millions and trillions of cells, and usually that's just a normal process that's kind of self-regulated. However, sometimes issues can arise where they start growing uncontrollably.
Okay.
And also, we would rather, non, t'as préféré que question vienne à la fin. Ray, I see that you intervene. If you have any questions, if you can leave it until the presentation is done, that would be good. Write it down, please.
All right. So then the age-old question is really, what causes cancer in the first place? We know that aging is a very big risk factor to develop cancer. As we get older, again, our cells are constantly dividing. We don't really, and as we acquire mutations over the course of our lifetime, mistakes can happen. Your body doesn't work like how it used to when it was younger. And around 85% or around 80% of individuals who are diagnosed with cancer are typically diagnosed over the age of 50. And that's really just due to the cumulative effect of aging. Typically, we're more likely to see people get a diagnosis of cancer in their 60s or 70s. However, obviously, there are circumstances where people could get diagnosed earlier.
Cancer, en général, gen rapport avec l'âge et gen des facteurs qui l'environnement nou qui a occasionné ça. Particulièrement nou ka wè, gen pile moun, le yo vin gen diagnosis maladie cancer an développé, l'âge gen bagay pou fè avec même, mais à part de ça, gen un pourcentage de moun qui gen cancer qui pa gen rapport avec l'âge.
All right. Can you guys see that?
Mm-hmm. Yes. Yes, it's better. Yes.
Okay. Okay. Sorry, let me go back. So other factors including as to why someone might get cancer include environmental factors. So the food that we eat, the air that we breathe, stuff we're exposed to, whether we know about it or we don't know about it, ultimately putting us at a higher risk. We know that people who were in 9/11 have a much higher likelihood of developing cancer compared to others. Sometimes if someone is exposed to asbestos or radiation in their home, that could also put them at a higher risk for cancer.
À part l'âge, environnement côté nou ap vive, manger, gen un effet qui te ka occasionné cancer. Par exemple, nous gen moun qui te yo te fait attaque sous États-Unis en 9/11, moun qui te l'environnement l'époque ça yo gen plus chance, bon, les plus malchance, puis yo te ka développer cancer que moun qui pat l'enlever ou non comme ça.
We know there's also hereditary risk, which is really what I'll be talking about today, where someone is born with something that puts them at a much higher risk to develop cancer over the course of their lifetime.
Héréditairement, cancer, li possible. Et c'est de ça que nous parle parler aujourd'hui, hein, côté il y a des monde, yo juste fait avec gène dans eux-mêmes et puis éventuellement cancer l'a développé.
Typically, we would see somebody with a strong family history of cancer or maybe diagnosed much younger if there's a hereditary risk.
Si gen un risque héréditaire, nous ka wè un monde yo vin développer cancer dans l'âge qui plus jeune et puis yo ka gagner cancer dans cas là.
Other things include infection. So we know that hepatitis A and hepatitis B put someone at a much higher risk to develop liver cancer. HPV puts someone at a higher risk for cervical cancer. And H. pylori is an infection that can occur in the stomach that is relatively common, but that can lead to getting stomach cancer.
Maladie tout, par exemple, infection, moun qui fait hépatite, yo ka ba yo cancer foie, moun qui HPV, c'est ça cause cancer tout et H. pylori, c'est une maladie qui est très commune mais malheureusement tout qui a occasionné un cancer tout.
And different hormonal or immune balances can also impact your risk, making you just a little bit more vulnerable or susceptible to getting cancer compared to everyone else.
Okay. Hormones nous tout, c'est de hormones que nous avons même qui fait nous plus susceptibles pour nous avoir cancer.
So now I have a question. You can put it in the chat. But what do you think is the average woman's risk to develop breast cancer? So A, 1 to 2%, B, 10 to 13%, C, 25%, or D, 44%.
Qui risque que nous pensons figurer pour qu'à développer cancer? 1 à 2%, qui réponse A, 10 à 13%, réponse B, 25%, réponse C ou B, 44%. Nous avons mettre réponse nous dans le chat room.
Okay. Okay, doke. All right, so I see that a lot of people are picking D, which is very, very high. 44% is a very high risk. The actual answer is 13%. So 1 in 8 women are expected to get breast cancer over the course of their lifetime. So it's not as high as 44%. Obviously, there are some families, or most women know somebody who's had breast cancer, so the odds are pretty high. But generally speaking, we would say it's around 1 in 8 women get breast cancer.
Ok, mais c'est pas vrai, nous, ton petit jalè, qui bon bonne nouvelle, c'est 13% de monde, yon sur 8 filles gen cancer. C'est pas genre de tes pensées. Parce que majorité de monde qui répond, pas choisi un pourcentage ça.
And again, this is general population risk. So every woman's risk. This isn't taking into account like your hereditary risk, or if you have a family history or personal history.
Bien entendu, généralement c'est ça lié, sans compter si nous gen bagay héréditaire ou du moins l'autre effet qui était causé cancer.
And these are just some other general population cancer risks. So cervical cancer is a little bit lower, 0.6%. Colon cancer is around 4%. Lung cancer obviously is influenced by smoking or other sort of exposures, but it's around 5.6%. Ovarian cancer is pretty low. Same with uterine cancer and then thyroid cancer. But obviously there are other cancer types that are not included, but these are just some of the most common ones.
Gon tableau que li prezente là nous-mêmes, côté que l'autre type de cancer, yo pourcentage yo, ma particulièrement cancer poumon, li yon ti jan à 18, c'est tout simplement parce que li fumait, gen un pile à voir ça.
Okay. And so in order to really address this cancer risk, the government created the United States Preventative Services Task Force, which essentially creates, insight into what should we do about addressing cancer risks. So as most of the women here might know, starting getting your mammograms between the ages of 40 to 74. For cervical cancer, that starts pretty early, where we recommend having pap smears between the ages of 21 to 65. As we kind of discussed before, related to infections, majority of cervical cancer is related to HPV. And so having that screening done annually, or every few years, every 3 years or so, can exponentially lower or decrease somebody's risk. And same for breast cancer. Not all women just get mammograms. Sometimes if women have more dense breasts, they might get a breast ultrasound or a breast MRI. But generally speaking, this is what we recommend for everybody to get: colonoscopy starting at 45. If someone has a history of smoking, we recommend screening for them. And then for men, prostate cancer screening starts later in life.
Okay, go ahead. You can go ahead.
Okay. Okie doke. And so what are some other ways that we can really prevent or avoid somebody getting cancer? So obviously screening is a big part. Getting your mammogram regularly, going to the doctor for prostate exams for men, starting your colonoscopies, getting clinical breast exams with your primary care provider. These things are really the most effective ways for us to, lower somebody's risk to develop getting cancer. Eating healthy is also a very good option. All the things that your doctors tell you all the time, like regular exercise, moderate alcohol consumption. But also genetic testing is another facet of cancer prevention, and that we know that if somebody is born at a higher risk to develop cancer, then we can offer them increased screening compared to what we might offer the general population.
Ok, gen série de prévention pour cancer, c'est bien sûr faire test pour ça pour manger bien, faire exercice, bon, c'est advertisement, nous va même dire modérer alcool consommation, juste nous, ça pas pour nous, hopefully. Et ensuite, pour faire test génétique, parce que si on monde à risque de cancer, ça c'est le gouvernement qui établit que yo encouragé yo faire genetic testing.
Okay. And so zooming out a little bit, when we were talking about the different like what is cancer in the first place, there are also different types of cancer. So as I mentioned before, we'll talk about hereditary cancer today, but most cancer generally just occurs sporadically or randomly. You know, unfortunately, people can do everything right and still end up getting a diagnosis of cancer, and we don't really have an explanation for why it happened. As I mentioned before, it could be due to aging, environmental factors, but ultimately, we don't really know. Only around 5 to 10% of cancers are known to be genetic or hereditary, meaning you were born with something that puts you at that much higher risk to develop cancer compared to what we see for the general population.
Cancer, kon jis rive li jis, nou ka di li jis donne, sa rive. Mais se cancer ki héréditaire, ki génétique là, c'est seulement 4%,
5 to 10.
5 à 10%, côté nou ka di, c'est un moun ki gen cancer la famille là, ou bien moun ki jis gen tendance pour développer cancer, alors que gen des moun qui fait tout ça ou supposé faire, yo manger bien, yo suivre régime alimentaire qui sain, qui bio, yo fait tout ça pour, but malgré tout, yo gen nouvelle que yo fait cancer.
And so there are certain things when we look in someone's personal or family history might make us more suspicious that they're in this hereditary category compared to just the sporadic category where cancer happens randomly. So if someone is diagnosed with cancer very young, if there are multiple people in their family with either the same cancer or cancer types we might see run together, that makes us a little bit more suspicious that maybe this cancer could have been inherited, or someone who doesn't have cancer, maybe they're at a much higher risk to develop cancer compared to everybody else.
Go ahead.
Okay. Typically, sporadic cancers might be when we see somebody get cancer in their 60s or 70s. As I mentioned before, aging is a very big risk factor to develop cancer. If someone is the only one in their family with cancer, we're a little bit less suspicious that this was inherited, since there's not a lot of other people in the family with cancer.
Cancer sporadique là, si peut-être au monde qui ont déjà avancé en âge, disons 60 à 70, me dit avancé, c'est parce que pas que le grand monde vraiment, mais plus jeune, il juste été considéré un cancer, alors que l'enfant mieux, par contre, le cancer, c'est ça fait le cancer qui vient sporadiquement.
Okay. And essentially what hereditary cancer means, zooming back a little bit, we all have genes in our body, and your genes decide different things in your body. We also have cancer genes in our body that are responsible for protecting us from getting cancer. If you're born with any of your cancer genes not working how they should, that's what can put you at a higher risk to develop cancer. When the genes are working, they're working to protect you from getting cancer. If you're born with them not working, then you're at a much higher risk to develop cancer.
Would you repeat what you just said?
Mm-hmm. Yeah, so most cancer, so thinking about genes, we all have genes in our body, and our genes do different things throughout the body. Your genes determine your hair color, your eye color, they keep your body functioning. We also have cancer prevention genes. And when those genes are working, they're working to protect you from getting cancer. If you're born with one copy of that, if you're born with those genes not working, you're put at a much higher risk to develop cancer over the course of your lifetime.
Nous avons des gènes que nous faisons ensemble avec lui qui me pense qui est important dans sa quotidien, qui prévenir cancer. Et si gène ça au travail très bien, nous bon, mais si gène ça ou gen n'importe bagay qui pas fin trop encore ensemble avec yo, c'est là ça génétiquement li ka causer que nous gen cancer.
And so the reason why knowing whether or not your cancer is random or it's hereditary is that if someone is born with something putting them at a higher risk for cancer, so they have a gene putting them at a higher risk to develop cancer, then their risk for cancer is a lot higher than the general population risk we were talking about before. So for some of these genes, instead of having that 13% risk of breast cancer, your risk for breast cancer could be up to 87%. Instead of having a 3% chance of having uterine cancer, your risk could be up to 60%. And same for ovarian cancer, for men, prostate cancer, colorectal cancer could be up to 100%, which is why it's valuable to know whether or not you have anything that you were born with to put you at a much higher risk to develop cancer, because then it might warrant you getting high risk screening.
OK. So, il est important que nous fassions différence là entre cancer qui juste généralise, cancer qui juste arrive sur nous comme ça avec si au monde héréditairement, il y a tendance pour avoir cancer là parce que son grand écart que lié. Par exemple, pour cancer du sein, au monde qui que cancer la veine sur les comme ça, il y a un pourcentage à 12%, contrairement si que génétiquement nous avons tendance pour nous gagner la famille, monter jusqu'à 87%. Et ceci pour tout que c'est cancer utérine, cancer ovaire, cancer prostate, et puis cancer du pancréas, et pour colorectal cancer, même là, jusqu'à 100%. C'est ça fait que l'important pour nous connaître, comment, là, qui côté nous situer, là, le tableau cancer, là.
Yeah, and so things that might make us more suspicious, again, that maybe someone has a hereditary cancer, if you have a family or personal history of people diagnosed young, if there's a lot of people in your family with the same type of cancer.
Un point que pour nous connaître, c'est si au monde très jeune, à un jeune âge, développer cancer, ou bien si dans pile monde dans la famille hein, qui fait maladie cancer là.
And so now we'll talk a little bit about cancer genetic testing, talking about who does this testing, what is cancer genetic testing, when might somebody get it, where would they get it, and what is the point of getting it in the first place.
On va parler du test cancer là. Qui monde qui a gagné, pour qui raison, pour monde qui a gagné, qui côté, et pour qui ça, que on monte qu'a fait test génétique cancer là.
Okay, so who should get genetic testing? So as I was talking about before, there are certain things when we see in a family history or personal history might make us more suspicious that there's something genetic. There are national guidelines that let us know if you meet this criteria based off your personal or family history, then you should get genetic testing. And so insurance is more likely to cover that testing for you.
Si que nous, d'après ça que pour l'État bail, si que nous prouver que la famille, nous gagne possibilité de avoir cancer, assurance ça prouve ça. Même je trouve en parenthèse, ça veut dire son test qui est cher parce que c'est pas toute assurance qui prouve.
No, so the max out of pocket cost for the test can be $250. For it depends on the lab that the test is ordered from, but generally, like if you don't want to go through insurance or insurance doesn't cover it, the max would be $250. A lot of these labs do have pretty generous patient assistance programs where they typically cover the full cost of testing.
So, si me comprendre, pour faire test là, génétique test, on va payer $250.
That's if insurance doesn't want to cover it. Most people, if they meet criteria for testing, insurance will cover the test and there'll be no cost.
OK. So, test, pour faire test génétique là, généralement, c'est $250 si assurance pas couvrir. Mais si une couverture médicale qui a accepté, nous pas payer. Ensuite, il y a des organisations qui pourraient qui pour aider monde qui ont besoin qui pour payer pour tester ça.
Yeah. And so, as I mentioned before, multiple first or second degree relatives with cancer, with the same cancer or cancer types we might see run together. So if you yourself had breast cancer, your mother had breast cancer, your mom's sister had breast cancer, you have cousins on your mom's side with breast cancer, that would be suspicious. And therefore, maybe genetic testing would be helpful to see if there's something that can explain all this breast cancer in your family.
Si par exemple, nous en tant que fille, maman ou bien grand-mère, ma tante, bon, moi parler de fille seulement, la famille bon maman nous, qui t'a gagné cancer, ça t'a veut dire que pour ta très bon pour nous-mêmes, dans le fait test nous-mêmes.
Yes.
C'est ça, on dit.
But it doesn't matter if it came from your dad's side too. If your dad has multiple sisters with breast cancer, that still could put you at a high risk. Just because it's from your mother's side or just because it's from your father's side, there's no gender like predilection for that.
Ok. So, depuis que nous avons fi que c'est l'un bon maman ou bien bon papa qui te gen cancer, ça mette nous en position côté que nous te ka susceptible pour nous ta développer cancer, so li encourageant pour nous ka faire test.
Okay. Well, ultimately, anybody can do genetic testing and anyone can get genetic testing. As I mentioned before, let's say, you go and you don't meet criteria for testing, you can still do testing. It's just that cost would likely be $250. They usually have great payment plans or different sort of assistant programs to still offset that cost.
Okay. En général, n'importe monde qui t'a voulu faire test yo ka fait li, mais ça parce que vous assurance ou pas, c'est $250 que lié et j'aime te mentionné, gan pile offre que on sait des organisations fait que ka couvrir pour lui. M'a posé une question sur ça. Est-ce que c'est tout well, peut-être on peut arriver sur ça. Qui côté pour
Well.
Go ahead, just go ahead.
Okay, so what is cancer genetic testing? The actual test itself is just a blood test. They typically take 2 small vials of blood, and it usually takes 3 to 4 weeks for the results to come back. On your genetic test, you can usually customize what you want to look at. If you want to look at breast cancer genes, if you want to look at ovarian cancer genes, colon cancer genes, stomach cancer genes, you can typically pick and choose what you want to put and what you want to look at to see if you were born with anything to put you at a higher risk for any of those cancers.
Does the price vary if you choose? Okay.
No, so the price doesn't vary by that at all.
Okay. Ou nous, le test que nous pouvons faire, il y a pris 100 nous, et puis dans 3 ou 4 semaines, nous avons des résultats et nous avons choisi spécifiquement qui type de cancer que nous avons fait garder pour nous, qui ça que nous avons gagné. Et puis, on n'a pas changé pour ça.
Okay, and so when should you get cancer genetic testing? Cancer genetic testing is obviously most valuable when it's used as a form of prevention. When you don't actually have cancer, but you notice there's a family history of cancer, so you want to better understand your risk to develop cancer. So then you do the test, they let you know, were you born with anything to put you at a higher risk? If you were, then that might warrant maybe instead of starting your mammograms at 40, maybe you would start your mammograms at 30.
Ok. Qui moun qui a fait test là, n'importe monde et meilleure façon pour faire là, c'est prévention. Si par exemple, nous fait test là, nous voyons que gain tendance cancer dans nous-mêmes, au lieu que pour nous faire disons mammographie à 40, nous avons commencé là à 30.
Another time where
One just question, qui est-ce que gon l'âge pour qu'a commencer faire test là?
yeah, once somebody turns 18, they're able to do cancer genetic testing.
Okay. Et à partir de 18 ans, n'importe monde qui a fait un test génétique là.
Another time that people oftentimes get cancer genetic testing is when they are diagnosed with cancer. And so that can sometimes let them know, why did I develop this cancer in the first place? Did this just happen randomly and by chance due to environmental factors? Or was I born with something that caused this cancer diagnosis?
On l'autre fois encore, si moun nan gen cancer là, li ta bon pour connaître qui cause cancer là. Est-ce que génétiquement li te gen ou du moins c'est environnement qui fait que gen? Oh, pas bailler.
Sorry. And so that can also help with treatment and surgical decision making. Oftentimes, for some of these genes, kind of recapping what I said before, those who are at a higher risk to develop breast cancer can sometimes not only be just at risk for breast cancer, but sometimes these genes can overlap with other cancer types. So not only were you born with a high risk for breast cancer, you're born with a high risk for maybe multiple breast cancers, and you're born with a high risk for maybe ovarian cancer as well. In which case, that might require other sort of screening and maybe more preventative surgery, even if someone has a diagnosis.
Did you say multiple breast cancer?
Yeah, so oftentimes for those other things that make us suspicious are when someone has more than one diagnosis of breast cancer. Sometimes women can get both breasts having breast cancer at the same time, or maybe they have one breast impacted and then 5 years later they have another new breast cancer.
Okay. So, li bon pour nous te ka konnen parce que il y a plusieurs traitements qui ka opération, juste traitement qui ka arrivé, mais nous fait test là, nous ka konnen exactement qui cancer parce que apparemment il y a plusieurs cancers que au monde ka développé ou ka sein gauche là ka affecté et puis quelque temps plus tard l'autre sein a affecté. So, avec le fait test là, avec traitement, ça a prévenu pour cancer là continuer ou redévelopper.
And ultimately, anytime you can get cancer genetic testing, whether you were diagnosed 5 years ago, whether you were never diagnosed, anytime is a good time to get it.
Okay. Il encourage n'importe l'heure que nous avons possibilité de faire testing génétique là.
Okay. So where do you actually receive cancer genetic testing? How can you do that? So you can meet with someone like me, who's a cancer genetic counselor. Oftentimes somebody's PCP or their OBGYN or maybe their GI doctor might also offer them genetic testing or offer it in the office. And then sometimes there's direct to consumer testing. So I'm sure you guys might have heard of like ancestry.com or 23andMe. Those aren't largely the most reliable things that you should go through. We really recommend getting testing done in like a clinical setting, but ultimately there are a few different options as to where you can get testing.
Nou ka fe test la on conseiller génétique takou Nicky ou bien gynécologue nou ka ordonné ou bien docteur traitant nou ou du moins gen ensey de l'autre instance, l'autre compagnie qui fait ça, mais yo pas plus à 100% et accurate, but nou ka toujou checker pour nou ka fe test génétique là.
And so why should you get cancer genetic testing in the first place? It can help understand your risk. It could let you know if you were born with something to put you at a much higher risk to develop cancer. Oftentimes, if someone, does genetic testing and they come back with something positive, insurance is more likely to cover increased screening to kind of avoid them getting cancer in the first place. So they'll probably pay for breast MRIs and mammograms and other sort of imaging that might not be, eligible if someone doesn't have a genetic reason as to why they're getting it in the first place.
Go ahead.
Okay. There's also preventative healthcare. So whether that means getting that imaging more often. Sometimes if women know that they're at a much higher risk to develop breast cancer or ovarian cancer, they might have preventative surgeries like having a hysterectomy or having their ovaries removed just because they know they're at a much higher risk to develop it in the first place. And another thing that's valuable as to why someone should do cancer genetic testing is that it can help inform family risk. So if you know that you were born with this higher risk, and let's say you're a mother and you have 2 kids, you do genetic testing, something comes back positive, we know that there's a 50% chance you could pass that down to each of your children, in which case they might also be at an elevated risk to develop these type of cancers. And so they should also get high risk screening as well.
Go ahead.
Okay. Okay, so now I have a true or false question. It's kind of difficult, but I just did genetic testing and my results were completely negative. This means I'll never get cancer. True or false? So you could write it in the chat or say it out loud.
I think it's false.
Okay. Got some more falses. Okay. All right. So the answer is false. That's not true. Genetic testing is valuable for a lot of different things. It could let us know again if you're born with something, but as we spoke about in this from the start, not all cancer is hereditary. So genetic testing is a valuable tool, but it isn't everything. It could help let us know if you're born with the high risk, but it doesn't necessarily mean that your chance to get cancer is 0%. If you come back with negative testing. Again, most cancer isn't known to be hereditary. Only 5 to 10% is.
Réponse non, c'est non. Seulement 5 à 10% de cancer qui est héréditaire parce que c'est vrai, nous faisons test là, mais ça n'a pas forcément dit euh, que cancer là a privé.
Other things to consider when thinking about cancer genetic testing is, that potential out-of-pocket cost. So that $250 can be a lot of money, and having to pay that and can be a lot. There is a law set in place currently. It's called the Genetic Information Non-Discrimination Act, or GINA for short. And it essentially means if someone does genetic testing and comes back with something positive, then they're protected from insurance discrimination, from health insurance, as well as discrimination from their job. But it doesn't mean that they have protection against life insurance, long-term care insurance, or disability insurance. So that's also something that's valuable to know is if you want to get life insurance, you do genetic testing, something comes back positive, you might have difficulty getting that in the future.
OK. Gen loi, pas fin comptant de, gon loi qui passe côté, yon moun qui fait test là, et que li positif, li gen protection pour pas subir discrimination. Néanmoins, si par exemple, on moun fait test là, li positif, dit que le cancer, li pa gen aucune protection pour, par exemple, pour ta gen assurance de vie ou genre de bagay ça. C'est pour que ça dans tête nous, comparativement avec assurance de vie, nous pas gen aucune protection sur ça.
Also, there is an impact to other family members. So, again, let's say you have this diagnosis of cancer, and now you know that there's a chance you could pass that down to your children. That can obviously have an impact on yourself as well as other family members. For some of these, if someone comes back positive, the frequency of screening can be a lot. For a lot of these genes that pose a high risk for breast cancer, it might mean that you have to go to the doctor very often. It might mean that, you have to get a lot of imaging done. And so obviously that can have an impact on, yourself, as well as emotionally what sort of impact that can have with you, which is going to the doctor that often, potentially getting false negatives, and some anxiety that can arise with that. Okay. And so just wanted to provide really just an example of something that I've noticed in my care where I've had patients who have a very strong family history of breast cancer. They've never heard of cancer genetic testing before. And then so we offer them genetic testing. They come back with something positive, and just kind of the relief that they have with knowing that this cancer that was really impacting all their loved ones. Multiple family members had passed away, and not really having a clear-cut example or understanding of what was going on, but having an explanation or an answer through cancer genetic testing not only provided them with some comfort to know, wow, okay, we were born with something that caused all this cancer in our family, but also now there are things that we can do about it for other family members so that we can hopefully avoid this kind of trail of cancer disrupting like their family altogether. And so now that's all. No.
Non, c'est parce que moi, vais à tout, 17h20, je vais poser des questions, et nous connaissons 8h, right, président? Jusqu'à 8h. Yes, nous avons jusqu'à 8h, c'est parce à cause de ça que nous disons qu'on y a nous là moment question yo. So,
And then I also have some resources that I can just share so that you can send just how to find a genetic counselor. You just put your zip code and then more information about cancer genetics.
okay. Ok, now, si nou gen n'importe question qu'on y a, ma permet si moun gen question. Moi-même, moi go question, mais m'a juste, si gen l'autre moun gen
Sorry.
question. Go ahead.
I know there's a question in the chat about
Pour que ça Philippe
cortisol.
va apparaître là.
Okay. What does it say?
Cortisol soursop, one of banana is good for cancer. Had it been proved scientifically?
Okay.
So there are a lot of things that we know can potentially lower somebody's risk for cancer. Unfortunately, they're not really proved scientifically because they don't work for everybody. There are people who smoke cigarettes every day and never get lung cancer. And there's somebody who's a neighbor to someone who smokes cigarettes every day and they end up getting lung cancer. And so, unfortunately, we can't always predict what will impact everybody, and everybody's body is different. Obviously, we encourage healthy lifestyle, and so those things are helpful. But ultimately, once cancer forms, dietary changes might not be able to essentially cure that cancer.
When go l'autre question encore, what is the most accurate prostate cancer test for men? Is it the DRE or the PSA?
Yeah, so both of them are both pretty effective tools to be used kind of concurrently. Prostate cancer is one of the most common cancers for men. 15% of men will get it. And men who are Black have just a much higher risk of developing it. So that's like 1 in 6 men will get prostate cancer. Luckily, it is one of the more slow growing cancers and that people typically don't pass away from it. But yeah, the screening that we recommend is to start at the age of 50, 55, and to have that digital rectal exam and then a PSA blood test.
Ok, tous les deux, DRE avec PSA, c'est des tests qui révèlent effectifs, mais heureusement, cancer prostate c'est un cancer qui tue moun et il peut pas tuer moun en pile et ensuite gagner
Pas tellement en pile.
No, that doesn't.
Qui pas tuer moun en pile, mais depuis qu'on fait test là, il y a prévention, quoique moun noir gagne plus tendance et sorti garçon noir tendance à faire les. Now, question que je voulais poser sur breast cancer. Gagner, nous connaissons que bah on est sur des patients qui garçons qui gagnent breast cancer. Est-ce que nous par exemple nous connaissons pour filles par exemple moi j'ai 2 petites filles. Ti fille, m'te doit faire test sans ta pensé que ti fille à partir de 18 ans qu'elle fait test breast cancer par exemple, elle fait test ça. Mais nous avons tendance que nous pas tellement minimiser pour un garçon t'as gagné cancer du sein. Qui pourcentage cancer du sein qui gagne le garçon qu'on y a là si ou gagne patient qui gagne garçon qui gagne cancer sein.
Yes, I've had a few male patients with breast cancer before. It's extremely rare, like less than 1% of men will get it. So it's not that common, and we don't really offer screening for like the general population. But a few factors matter. So like how much breast tissue a male has can also increase their risk to get cancer as well. So if somebody has like more breast tissue than maybe like the average man, then that could also potentially influence their risk. Or if they have something genetic, some of these genetic genes do pose a higher risk for male breast cancer, which would warrant men getting clinical breast exams as well as sometimes even mammograms.
Okay. Est-ce que l'autre monde qui a une question? Pérette.
Oui, merci. Oui, merci. Alors, je dis à son présentation, son moment historique, oui, parce que maman a petite, il en a fait interpréter, et puis l'autre l'a présenté. Merci Nicky pour la belle présentation que vous avez. Moi, j'ai un commentaire et puis j'ai 2 questions à me poser. Premièrement, commentaire là, c'est que il y a parfois qu'on a interprété pour patient parce que là, yo découvert que yo fait cancer après test ça yo fait et puis comme si yo dit non yo pas quoi que ça parce que pas gen moun dans famille qui fait cancer. Donc on connaît que vous parlez de sporadique là mais comme parce que dans la communauté nous avons pile travail qui pour faire dans ce sens là il pas tout le monde qui comprend bagaille même genre et puis comme si nous avons des préventions naturelles que monde pensait que capable de faire qui est capable de bagaille ok si ça dans la famille pas si pas dans la famille je juste dis ça me connais gain tel bagaille me gain tel quoi le faire pour capable stopper ça ça c'est alors qu'ils sont capables de à mon ça comme conseil et puis ensuite le a fait test pour le gain plusieurs qualités cancer comme si le gain questionnaire là on rempli yo mande ou si gain cancer dans famille et puis on prend toute qualité cancer est-ce que parce que gain yon monde dans famille qui gagne yon un cancer ça risque là comme on doit faire breast cancer mais grand-père me fait prostate, cancer prostate, comme si est-ce que cancer yo, gon façon yo connecté avec l'autre.
Yes, great question. Yes, so there are definitely, so I'll start with answering the second question. There are definitely cancer types that we might see run together that might make us more suspicious. So when we see breast, ovarian, prostate cancer, pancreatic cancer, all of those make us very suspicious. Ovarian cancer and pancreatic cancer are more rare cancer types. So whenever we see those also make us a little bit more concerned. So if there's a lot of breast cancer, if there's a lot of breast and ovarian cancer, if there's breast, prostate, pancreatic, and on the other side of that, thinking about GI cancer. So if we see colon cancer, stomach cancer, those two cancers together, that also makes us a little bit suspicious for another type of hereditary cancer syndrome. And then thinking about people who have no family history of cancer, that is something that I think about often when I was talking about the guidelines, and even when I talk about things that make us suspicious, it's not perfect. And so I have had patients who, are 65, they get breast cancer, no family history, they do genetic testing, and they come back with something positive. And so I wouldn't have been suspicious because they're diagnosed a little bit later in life where we expect people to get cancer. They have no family history, but still they had something genetic that can explain why they got that cancer. And so that's why I kind of say it's important really for everyone, if they're interested in, to get genetic testing, just because although we say family history can kind of guide what makes us more suspicious, it's not a perfect system. And also a lot of people don't know a lot about their family history either. So people might not talk about cancer in their family. And so you don't know your aunt passed away, but you don't know how she passed away. And so those things, especially I worked at Kings County Hospital, which is a lot of Haitian or Caribbean Black people. And oftentimes, they would always just talk about how, we don't talk about that. I never knew how this person died. And so I don't know if there was cancer in the family. That's not something that we shared, which is why I really encourage, kind of one, talking with family members, but then two, if you're interested in doing genetic testing, to just go ahead and do it.
Ok, merci. Par contre, sur répondre première question, non, ça peut être posé concernant moun yo pa kwe lan ça et que si après un médicament préventif, tant que cortisol, bon moun qui se dit là.
Yeah, I answered that one.
Ok, all right. Nous apprenons Marjorie Mouline, ensuite, gon question dans le chat là que je vais poser, ensuite, nous allons prendre Ray. Marjorie, go ahead.
Ok, thank you, Nicky, merci pour présentation. Good job.
Thank you.
Question nan, moi, ça rememando, est-ce que yon moun qui fait H. pylori à répétition, qui risque qui gagne pour moun ça t'a fait, t'a gagné un cancer d'estomac?
Yeah, great question. So H. pylori is a risk factor. And so if you get endoscopies often, which is a screening tool that goes through your mouth and checks your upper GI tract, and if you get that and they take samples of your stomach and they see that there's H. pylori present, we know that that is a bacteria that can put that messes with the lining of your stomach that could put you at a higher risk for stomach cancer. Even still, I don't know the exact risk number, but it's still a relatively low risk for someone to get stomach cancer just based off H. pylori. But we know it is a risk factor for them to end up getting it. So it's still valuable to keep up with those endoscopies, take whatever medication that is needed to kind of address that H. pylori. I don't know the exact number, but I believe it's like less than 10%.
Ou pas besoin de traduction, pas vraiment.
Ti sa m ka kompren.
Ok.
Yeah. So, m de kon deuxième question, Nicky. Ou fini?
Yeah.
Ok. La son, m pa konen, m ka di son mit ke liye, an pil fi toujou pe al fe mamografi, parce ke yo di, tant yo fel souvan, yo gen plus risk pou yo fe kanser. Eske ou ka di nou, ban nou ti eksplikasyon sou sa, pou nou ka retire mit sa nan tet nou?
Yes, great question. So think about mammograms or breast MRIs or all those imaging. They do have inherent exposures that can happen through like the machine and all that other stuff. But ultimately, it's like a cost benefit analysis. So the benefit that you're looking to see if you have breast cancer is much more important than the maybe small percentage that might increase your risk for cancer. Again, every woman has a risk for breast cancer. It's around 10 to 13%. And so ultimately, we think that having repeat mammograms, that is the best gold standard way for us to check for breast cancer. And so it's a lot better to just do the mammogram, even if the risk is like 0.0001% that you can get breast cancer from getting them recurrently.
Thank you.
Mwen gen question la, gen moun ki pose. Mwen gen deuxième petite film ki pral gen 2 mois depuis li fe opération cancer nan sein. Li poko gen petit. E processus yo en pile. C'est pas facile pour yon famille. Qui ça que nous ka fait pour li pour arriver pour chimiothérapie? Vous comprenez?
Like, what should she do before she gets chemo?
No, okay. Once daughter had a surgery for breast cancer. She has not have any kid yet, and it's kind of difficult on the family. So what can they do when it's time for her, for the child to have chemotherapy? Because she has,
she wants to have children.
I would
the
assume
daughter.
so. Yes.
Well, I know a lot of
young.
patients. Yeah. So I mean, I've had like very young patients who are in their like 20s, like 25, 26. And from my understanding is that they usually do egg freezing beforehand, where they have this procedure that, kind of takes the eggs out, freezes them before they go through chemotherapy, just because chemotherapy can impact your fertility and could potentially do some damaging aspects to also your eggs. And so usually if someone is planning to have kids, they might get their eggs freezed to hopefully, help with the impact that could have on like your fertility. And so having, like, you can still get pregnant after going through chemotherapy and all that stuff. It just sometimes can be a little bit more difficult.
Ma pe ajoute sou sa, men eske diagnosis cancer lan li men ap gon impact
on your risk, your chance to have children?
Yes.
Yeah, I mean, ultimately we think that like it does in some capacity, but not enough to where somebody could not have children. So obviously, like fertility and treatment, if you have radiation, all these things can impact your chance to have kids, but not necessarily like the cancer itself. But, being pregnant and having your hormones much higher, that can potentially impact the likelihood of another cancer. The risk is still relatively low, but things to consider for sure.
Okay. Thank you. Now we are taking a question, Ray. You on mute.
Oh, hey, sorry. So first and foremost, I just want to say thank you, Nikki, for that presentation. I think you did an amazing job. That was very educational. I just sort of wanted to elaborate on a previous person's question in terms of the mammograph. You were saying that like essentially it's better for us to test to like if you're at risk than to I guess what I was saying, like there wasn't a lot of clarity to like what is the risk of, let's say I don't have cancer but I'm gonna take the mammograph, like how much risk am I putting myself into that with that radiation? um
Yeah, we would say that the risk is probably like negligible. I mean, or just like not enough for it to not not enough for someone to, it's not enough to where somebody should not get mammograms, if that makes sense. I don't know the exact
that's
numbers. Wait,
sure.
what do you think?
No, sure. I mean, it's hard to quantify these things. I was just saying, it's like, even when you say it's not negligible, it's just like, I think a lot of people fear, like, I'm exposing myself to radiation that for, like, I'm risking myself to radiation when maybe nothing's wrong with me. And so, like, why would I do that? You know? Like, is what I'm,
Yeah.
like, the clarity there. And then, but you were saying, like, it's negligible, but you're still exposing yourself to radiation, I guess.
Yeah, for sure. I mean, I think there are a lot of environmental factors that we're knowingly or unknowingly exposing ourselves to with no added benefit. And so I think ultimately, if we're thinking about what is the point of you getting a mammogram, is to see if you're going to get breast cancer, and people will get breast cancer regardless of ever having a mammogram. Like, I think ultimately, when we think about zooming out a little bit, I think it's, you know, it's not enough for someone to not get a mammogram. Like, I don't.
Yeah, it's just, like there's this thing, like even when you get an X-ray, where just people like, I don't know, like there's this fear about, which I don't think is necessarily unwarranted, of just like you're exposing my body to X-rays, which I know will like create some type of radiation. You know what I'm saying? Like
Mhm.
there's just a thing where it's like, like how many times do I have to do this or expose myself to this thing? uh, just to make sure I'm safe. But I mean, that wasn't my main question. But I just wanted to um, add. I understood the previous question. Like I understand the apprehension there.
Mhm.
Um, the other thing I guess what I wanted to say, which is probably more of a nerdier question, and I'm sorry if I'm taking up your time with this, but I was just like, so like, but the way that you were talking about this, so like, are cancers essentially like mutations? And the way that you were talking about how they can um sort of come up out of not like out of nothing, you know what I mean, like how they just sort of can erupt out of nothing, out of nowhere, like, or do they operate as mutations? Is it correct to categorize them as mutations? I guess that's my question.
Yeah, I mean, essentially that it's like a mutated cell that just starts growing. Again, like our cells are really like we have thousands, trillions of cells in our body that are constantly dividing, separating. They're dying off naturally, and usually that process is kind of regulated, and there's like a flow and checks and balances with that. But sometimes those cells can make mistakes, and maybe this mutated in a way that, you know, is disrupting the overall flow, the tissue is damaged, and then those mistakes start replicating with other sort of normal cells. And ultimately, that's what leads to cancer, is that there's just a growth of abnormal cells, and that kind of invades tissue. It forms into a larger tumor, and that's what's really traveling throughout the body.
Okay,
Yeah, no,
thank you.
for sure. Thank you for that. Sorry.
Nou apren Jean-Marc ki gon question, ensuite gen yon question nan chatroom nan, ensuite Marjorie. Jean-Marc,
Ok, merci beaucoup. Me féliciter présentatrice là. Et question à poser, bon, ce sont des questions qui ont été genre. Moi, je suis novice, là-dedans, mais m'a posé question quand même. Première question, même, il y a un, deux, trois, peut-être trois. Ok, première question, non, c'est une question, peut-être que tout le monde la connaît déjà. Cancer, est-ce qu'il est contagieux? Ensuite, si un monde après un test cancer, il découvrit que il fait cancer là très tôt, est-ce qu'il y a un moyen pour stopper ou bien pour empêcher de développer? Et l'autre question vient encore, si on a une assurance vie et qu'elle découvre il fait cancer, est-ce que l'assurance là, est-ce que l'assurance là a toujours conservé? Et dernière question là, qui espérance vie il y a un monde qui gagne cancer? Si dans le cas que pas qu'à traiter.
Okay.
Merci.
Would you like me to translate for you, or you
Yeah,
got
just because I don't remember the first question.
Translate for me, please.
Première question, est-ce que is cancer contagious?
Yes.
No, cancer is not contagious. You know, there are like some infections that can be transferred. So as I mentioned, like with HPV, that is like an infection that's like sexually transmitted that can put someone at a higher risk. But you know, men wouldn't be impacted by that just because they don't have a cervix. But that is something that can be transferred, but cancer itself is not contagious. It can't be passed down. You can live with someone with cancer. That doesn't put you at a high risk to develop it.
Someone qui get cancer, I mean, someone with cancer, can they stop it, or is there any treatment to stop its development? Or
Yeah, I mean, usually most standard treatment is through surgery. So it kind of depends what stage someone is in with cancer. So earlier stages are obviously the best, where you're able to just remove whatever cancer is there. Sometimes that might require radiation or chemo. But if cancer is a lot more late stage, where we don't, you know, it's spread to other areas of the body and we can't really kind of contain it, then unfortunately, usually in those cases, we aren't able to stop it and we're not able to cure it. But generally, we treat cancer with surgery, chemo, radiation. Obviously, eating well, exercising, all these things play a big part. But those are really the main ways that we kind of cure or treat cancer.
Jean-Marc, ou pas besoin de traduction, pas vrai?
What was the third question, though?
The third question is, someone with life insurance, someone who already has a life insurance and has developed cancer, will the
plan drop?
Policy drop or what?
No, so usually the issue arises is if somebody is trying to get life insurance after the fact. So let's say you're applying for life insurance, they usually ask to see your medical records. If they look through your medical records and they see you have cancer, or they see that you have something else that could lead to cancer, or they see that you have something genetic that puts you at a higher risk for cancer, then they can decide what they want to do with that. They can deny you, they can raise the cost of your premiums. But if you already have a plan set in place and you're not planning to change it, and you get a diagnosis of cancer, then there shouldn't be any issues with that.
And what is the life expectancy for someone? Okay, go ahead, Farid.
Yeah, je voulais additionner un bagage dans life insurance là, c'est que comme si le monde n'a gagné, si monde n'a, il fin approuvé le jeudi, et puis il a rendez-vous, et puis, I mean, ou bien il juste out of the blue, il vient découvrir que le bagage, même si il a dans demain, une fois c'est pas menti, c'est bail, etc. Il pas, comme si ça déjà gagné, il gagne. Donc c'est protection, c'est prévention, c'est l'organisation de vie.
And what is the life expectancy for someone who is diagnosed with cancer? That's the last question.
Yeah, I would say it really kind of depends on a lot of factors. So one, what stage you are. Two, what type of cancer. So most women that get breast cancer usually survive it. Like over 93%, I think, of women who get breast cancer will survive it. Same with prostate cancer. It's one of those cancers that a lot of men will just get, and they usually survive and live through that. Other cancers that, you know, have like poorer outcomes are usually like ovarian cancer, pancreatic cancer. That's because we don't have general population screening for that. You know, getting your pap smear is checking for cervical cancer. It's not checking for ovarian cancer. And then for pancreatic cancer, you know, you get a colonoscopy, but that's not checking the pancreas. So usually for those two types of cancers, we usually end up finding them too late. Where, you know, people are already very symptomatic, and the symptoms for cancer can be very non-specific. You can have breast pain, you can have back pain, you can lose a lot of weight. And so sometimes if people wait too long to get that addressed, it could be months, could be weeks, could be years. And then they finally go to the doctor and they find out, you have stage 3, stage 4 cancer. And at that point, your life expectancy is usually much lower because cancer has spread. And so it's going to be very hard to contain or for them to treat you.
Ok, moi gen un commentaire m'a fait juste avant en question Dr. Roger Saint-Fleur gen. Moi connais une famille moi qui était très jeune assez, l'a fait mammographie à 40 ans qui m'a connais s'il changeait, mais c'est 40 ans il te dit pour moun commencer faire mammographie. Le la fait mammographie, il vient connaît que il gen stage 4 breast cancer. Li brab jam konen symptômes yo que te genyen, c'était do fait mal, et li ta peine enfante, li pense que c'est levé petit lan, kapé des faits que qui gen do fait mal tout ça. Et éventuellement, malheureusement, li pas duré trop de temps. C'est pas un petit monde qui te gon vie de qui te qu'on a mangé bien, fait exercice, fait tout bagage, but yet li te gen cancer là, éventuellement li mouri. Now, est-ce que gon changement non l'âge commandé pour me faire mammographie ou bien est-ce que si que cancer là ka juste le vini son monde comme ça, est-ce que éventuellement il y a permettre monde faire test sans que ou pas gain coût $250 pour payer pour les. Vous comprenez?
Yeah, that is a great question. And again, like something I see pretty often. I mean, I have patients who are younger than me, like 25, 26, 27, who have breast cancer, late stage breast cancer, and we have no explanation as to why they got that cancer. Unfortunately, it really just comes down to insurance. Recently, like I think within the past like 5 years, because previously mammograms started at 50. If I remember correctly, and now it's at 40. And same for colonoscopies. We recommended that start at 50. Now it's 45. And so I think as more younger people end up getting cancer, unfortunately, they start pushing it a little bit further down. But even like right now, if I were to ask to get a mammogram, it'd be very difficult. Like insurance might not cover it. My doctor might say no. It is difficult to get coverage. And so that's kind of the biggest deterrent with people getting screening at a young age. And it's unfortunate because again, like, yeah, there's so many young people with colon cancer now. And we're like, well, they're not getting colonoscopies until they're 45, but you're 25 with colon cancer. But unfortunately, not much that we can do, unfortunately. It's really just like insurance.
M'a posé question, Dr. Roger Saint-Fleur. I heard that men can get breast cancer. How can he get it? And is it necessary for men to find out as usual as a woman does?
Yeah. So men do get breast cancer. We were saying this before, like it's very rare. It's less than 1% of men will get breast cancer. It's because there's just not that much tissue present. So women obviously have a lot of fat and tissue in their breast, whereas men do not. In addition, women have these hormones, like we have estrogen and progesterone and all these things that can fuel breast cancer. And so that men just don't have. And so I would say unless you have a family history of male breast cancer, it's usually not indicated. Also, another benefit with breast cancer is that although not all women figure out this way, but you can usually feel or see a lump, you might have nipple discharge, there might be other things that you can see. Whereas with men, since there's usually less breast tissue, it might be easier to maybe pick up on certain symptoms. And I'll just answer that other question really quick.
Is it necessary for men to find out as usual as a man?
No, so men don't need mammograms. So it's usually clinical breast exams if there's enough breast tissue, or if you have a genetic predisposition to get male breast cancer, then we would recommend having mammograms starting at 50.
Okay. So nous avons une question que Marjorie, après Marjorie, c'est Pierre.
C'est pas Marjorie, c'est Sony.
Sony. Go ahead, mon copain.
Bonsoir, Filleul.
Bonsoir.
Et bonsoir tout le monde. Et encore une fois, Congratulations, Nikki. That was wonderful.
Thank you.
Wow, I can tell you. So my question is, when does a man should be worried about prostate cancer? Second, what are the symptoms or signs for someone like a man to be worried about it?
Yeah, great question. So, for Black men, I think it's especially important for them to kind of be aware of any sort of signs or symptoms. Sometimes there can be like pain in the prostate area. There can be like issues with like your bladder, where you might have like difficulty peeing and using the bathroom. Usually, like pain is also another symptom. Sometimes people also might just have back pain or weight loss. It's unfortunate for cancer. Oftentimes, again, like the symptoms can be very non-specific. So, you can have stomach pain and not think that that could possibly be cancer. But, if something is persistent, I just always recommend going to the doctor to check it out. Sometimes doctors can be dismissive about things related to that. If you're a man and you're getting PSA blood test or a digital prostate exam, the blood test does, if things are a little off the charts, then they might order imaging just to make sure whether or not, there is something abnormal going on.
Regarding the age, is there a specific age? Like, we should be, worried about it, probably by 40s, mid 50s, what it is, please?
Yeah, I would say like 45 to 50. Generally speaking, prostate cancer happens like in the 50s, 60s, like fifth, sixth, seventh decade of life. There are some studies that say men, if you live long enough, you just will get prostate cancer just because it's extremely, extremely common. It is, again, a very slow growing cancer. Usually they just monitor it. It's unlike women where, you have to get surgery and all this other stuff. Usually for prostate cancer, having like your prostate removed isn't usually the first line of action. They usually monitor, they'll offer like hormone therapy, in some cases like chemo prevention, but generally speaking, it's slow growing. Recommend start your screening at 50. If you have a family history, you could start at 40. And then getting those prostate exams, being aware of any issues related to like urinary incontinence, like having difficulty using the bathroom, stuff like that.
Okay, thank you.
Or like blood in your semen,
Yes.
blood in your stool, stuff like that can also be a sign.
Just about that, for prostate cancer, is erectile dysfunction, ED, is it one of the symptoms of prostate cancer?
No, not necessarily. I would say like not necessarily, no. Like there are a lot of people who have erectile dysfunction that don't have prostate cancer. I would say really like the main symptoms would be related to like urinary issues, pain, blood in your urine, stuff like that, more so than erectile dysfunction.
Okay. Pierre?
Ok, merci. Le ap avanse e kesyon an pil e pi yo interesant. Mwen te, pou symptome tap pale, e parfa, mwen menm se yon breast cancer survivor, mwen se, menm pat gen piye symptome. Mwen gen piye symptome. Sa yo vin konsidere kom symptome, kom si mwen men, kom si son bagay, kom si mte konsidere, fwet sen, gen yon ti gratel tout piti la dan, men kom si ki pa nuzib. Ki juste comme si on l'a comme ça me donc yo m'a demandé symptôme moi pas bail faire symptôme parce que me pas gain symptôme et puis après ça me dit pas connaître si ça qu'a considéré comme symptôme et puis me juste mentionner et puis yep ça veut dire comme si les bons prévention sont pas qu'à faire lié les bons pour nous capable checker tout autant nous checker puis bonheur les puis bon et question moi gain c'est on t'a mentionné que leur fait test génétique là ou gain doit tester pour n'importe qui bagaille d'ailleurs mais est-ce que c'est choix c'est patient qui gagne ou bien c'est l'hôpital là qui a fait provider qui a fait et puis ensuite est-ce que assurance a payé si me fait test là more than one?
Yeah, great question.
Assurance a payé pour tous les deux?
Yeah, I would say for about like whose choice it is, in my practice and where I work, it's always what the patient's choice is. So we will present, we could just look at breast cancer genes or just look at ovarian cancer genes or breast and gynecological, and then some stomach and GI cancers. But that's not the case for all practices. I will say it probably depends by what institution that you go to. But insurance is typically good about coverage. Generally speaking, they would cover it within like the next like 5 to 10 years. It also depends what sort of insurance you have. So like if people have Medicaid, usually there's not an issue with updated testing. But generally speaking, we would recommend retesting every like 7 to 10 years, just because we don't find out about new genes that frequently. And so repeating testing has like a lower yield or value.
OK. Et puis ensuite, je veux juste dire que conversation, ou dit que ou gain pile haïtien et que comme patient et il a toujours dit nous pas connaît etc. Donc nous avons profiter de l'occasion pour nous encourager mon yo capable gagner conversation avec famille, conversation petite non avec parents et nous capable connaître OK qui ça qui te gagne dans famille, parfois c'est pas connaît vraiment, parfois c'est parce que n'est pas confortable, c'est pas un bagage qui est naturel.
Exactly.
Nous, étant haïtiens, pour nous parler, nous avons tendance à cacher, on sait de bagages. Et pourtant, dans la famille, nous devons prévenir que petit nous, ou bien petit nous, avons maladie, même parce que nous cachons tout ça, vient faire.
Exactly.
C'est un problème.
Moi, question pas moi. Moi-même, la famille, par grand-mère, moi, bon côté papa, t'es fait cancer. L'elle était là, peut-être 40 ans, 50 ans. Mais il prend traitement, il guérit, mais éventuellement, il mourit là, il a 95 ans, pas de cancer. Ça veut dire qu'il fait une bonne trentaine jusqu'à quarantaine d'années sans cancer. Papa, t'es fait cancer tout, mais papa malheureusement mourit 2 ans de ça, c'est pas de cancer, il mourit. Ça, c'est côté papa, bon côté famille, maman, moi, pas connaît aucun là qui a cancer. Est-ce que je peux considérer moi-même à risque ou bien ou même à risque de cancer là, parce que est-ce que, parce que dit qu'on sauter en génération, est-ce que c'est nécessaire pour peut-être moi-même à faire CGC ou bien peut-être ou même?
Yes. So I think it's important for you to do it. You would be the main person. When we think about cancer genetics, it never skips a generation. So that's a common misconception. And just because cancer is on your dad's side doesn't mean that it won't impact you. Your genes, you have half your genetic information from your mom, half from your dad. So it doesn't matter if it's coming from mom or dad, you could be at risk. And also, it doesn't skip generations. So it could impact your generation. Generally, when we think about who should do genetic testing, usually we recommend the person that has cancer to get testing. But, if those people aren't alive, if you don't have access to them, if they don't want to do testing, then the second best person is also eligible for testing too.
Je continue la même question. Est-ce que si, par exemple, moi pas fait et que ou même on fait, petit ou fait et que ou pas gagné, est-ce que nécessaire pour moi-même me faire?
Yes, because when someone has something genetic, so we all have genes in our body. We have 2 copies of each, one from your mom, one from your dad. For thinking about those cancer genes, we have 2 copies. Let's say one of your cancer genes is not working from your mom, or from your dad's side, because your dad's side has all the cancer. So let's say you were born with 1 copy not working, you're at a much higher risk to get cancer. When you have children, you can either pass down your working copy or your non-working copy. So just because you pass down your working copy to me doesn't mean you don't have a non-working copy. You still have a copy that doesn't work and you're still at a high risk for cancer. It's just you didn't pass that down to me. So just because I'm negative wouldn't mean that you're negative. But if you're negative, then I would also be negative. So if your dad had testing and he was negative, then you would also be negative unless there's cancer from your mom's side.
Okay. All right. Merci, les 8 heures pile. Nous voulons dire merci, Nicky, pour disponibilité. Moi, bon, qui le fait, manger peut-être si période permet moi, dernière intervention ça, et puis pour une café. Go ahead. Marge or Sonny?
Et puis,
Non,
Nicky
c'est
capable
un
de faire conclusion
bravo.
après.
Bravo.
Thank you.
Ok, merci Niki, merci pour disponibilité ou merci ou t'es prêt pour te partager en connaissance ou ensemble avec nous. Et Jean-Pierre a mentionné, il est extrêmement important pour peut-être pour nous avoir une conversation ouverte avec famille, nous, non seulement pour nous connaître ça qui parle là encore, de qui ça a été mourir, et que nous faire prévention parce que nous, le langage, nous, créole qui dit, euh, prévenir, pas créole, prévenir vaut mieux que guérir. So, si nous t'es qu'à prévenir, maladie, l'état mieux pour jusqu'au, il nous a fait pour nous t'es qu'à commencer. Merci. Nous souhaitons qu'on ait disponibilité toujours. À une prochaine fois. Si on a passé ma là, présidente, nous, Perrette, à toi maintenant. Merci, Nicky.
Thank you guys.
Merci, Nicky. Donc, j'en ai mentionné, puis bonheur, c'est un moment historique, côté que maman avec petite fait présentation pour nous. Nous contents, nous apprécions ça. Et puis, information, vraiment, vraiment important. Je pense qu'il y a un pile de monde qui prend note, et puis, même le pas écrit, mais au moins, comme si capable de permettre à penser, pour réfléchir, et ouais, qui ça est capable de faire pour améliorer la santé, et puis, et les familles. Donc, non, Tabitha Vie, ou bien les sœurs Tabitha, nous voulons dire un grand merci et nous souhaitons que vous capable de continuer partager connaissances ensemble avec nous par n'importe qui notre moyen. Et puis, merci parce que dans la communauté, on va faire un grand travail. Dans l'hôpital que doit travailler, ou bien peuple noir, pour capable d'éduquer tout, c'est très bien. Donc, c'est un plaisir pour nous gagner tout le monde ensemble avec nous après-midi encore, parce que chaque samedi après-midi, excepté le premier samedi, nous gagnons une rencontre pour que nous partageons des informations, un sujet qui est tabou et puis sujet que nous trouvons qui est important dans la communauté. Samedi prochain, si Dieu veut, nous avons gagné en conversation avec deux petits pasteurs qui parlent parler de comment ils ont grandi étant que petits pasteurs. Nous demandons pour nous capables de faire plan pour nous avec nous et pour nous partager informations et tout. Nous enregistrer conversation ça yo, nous gagner YouTube page nous que nous partager et en conversation pour nous capable bailler l'autre monde pour l'autre monde capable accès à information ça yo. Merci du fait que nous partagez et merci à tout le monde qui était là. Avant nous finir, en général, nous toujours finir avec un mot de prière. Nous avons demandé pour nous incliner et puis nous avons prié pour nous, avant nous séparer. Merci. Notre Seigneur et notre Dieu, nous disons merci parce que tu es présent avec nous pendant un moment ça. Merci parce que vous avez petite intelligence pour le capable et connaissance pour le capable partager ensemble avec nous et ensemble pour nous capable faire une différence dans la communauté nous, pour nous capable grandir ensemble. Béni soirée pour nous, béni semaine qui a commencé et permettre que prochainement nous capables rencontrer ensemble pour nous continuer à grandir. Nous prions au nom de Jésus qui vit et demeure au siècle des siècles. Amen. Merci Astrid,
Amen.
merci Nicky, merci à tout le monde. Bonne soirée
you.
et à bientôt.
Bonne soirée. Ben, merci. Merci
Thank you.
beaucoup.
Bonne
Merci,
soirée.